Hi everyone, I'm Emily and I'm here with Kevin. He's my pastor at the Shack, which is a campus ministry here at USC. So Kevin is married to a nurse practitioner, so we thought it would be a good person to interview. First question, if you could summarize your image of nursing into one word, what would that word be?
Gosh, I'd probably have to say hectic. Solely for the reason that nurses, as my personal experiences with nurse practitioners, constantly dealing with patient outcomes, counterindications with medications, patient histories, patient families. It's a hectic position. So it's not just here, let me take care of you, here, let me give you a pill. It's a lot more than that, because it's both the caring and the outcome side of things.
Tell us how your interaction with a nurse, I guess your wife, has made a difference in your life.
Sure. Well, both my wife and because of what my wife does, a lot of our family friends are nurses and nurse practitioners, so it's helped our family to be definitely a more healthy one. It's helped us to not have as much white coat syndrome. I'd say that's worked a lot better for my son, who's 20 months old and loves playing with stethoscopes and otoscopes, and he loves going to the doctor. It's a game to him. I'm still a little afraid of needles. 12 years into being married to a nurse, but all in all, it's helped us to be a lot more health conscious and a lot more capable of seeing the humanity in the medical industry.
Right. So our topic for this project is on nurse injuries. So my question to you is, do you believe that the injuries nurses acquire is like an issue that needs addressing?
I'd say absolutely needs addressing. I mean, nobody really talks about the injuries or potentially even the workplace verbal or even physical abuse that can happen to a nurse. It's kind of an unspoken thing that goes on that nobody ever says anything about. So yeah, I do think some awareness is absolutely needed in that situation.
Right. So do you believe that this is a big issue in our society as a whole?
Yeah, absolutely. I mean, my wife is being a nurse practitioner on a regular basis. Patients feel completely okay verbally abusing her if she doesn't prescribe what they think she should.
Right.
I.e. they come in with what they think is a raging sinus infection and they think they need an antibiotic. Mm-hmm. And she knows what they have to be a viral infection and doesn't prescribe that. And when she does, immediately they begin to belittle and berate her because they spent 15 minutes on WebMD trying to figure out what they have, and they know for beyond a shadow of a doubt that they need an antibiotic.
For a viral infection.
Exactly, and despite all of her training and explanation that that's not going to help and potentially could make things worse,
right.
They feel it completely acceptable and okay. Some part of that's a human issue, but a lot of that's we have no problem denigrating our medical professionals, especially nurses and nurse practitioners, because we feel like we should be able to get out of them what we want.
Right. Yeah. So, do you have any recommendations for future nurses?
Gosh, thick skin. Thick skin. I hate to say that because you want to be completely caring and compassionate in what you do. At the same time, patients and patient families are hard. They're terrible historians, and it takes time and patience and the ability to sometimes take it with a smile on your face and continue to dole out good patient care, and that's hard. Beyond that, perseverance. Keep pressing. Keep looking for good physical outcomes with your patients, because it's not immediate. It's not quick, and it's certainly not always serviced by doctors in the industry. So we need nurses and nurse practitioners who can continue to see good, positive physical outcomes.
Yeah. Well, very good. Thank you for letting us interview you.
No worries. Thank you guys.
Yeah.